Hi there, it's Joe from Seniors Need to Know, and welcome to the podcast. Today we're going to be talking about primary care with your doctor. So, to get you ready for your annual visit or biannual visit, to give you some information to make it the best visit you can have. Before we start, just a couple of factoids for you. Over 20% of the US population is over 60. That's 1 in 5 people. It's by far the fastest growing demographic. And, there's an information desert out there for seniors seeking reliable information on their health and wellness. And today we have an expert on health and wellness, and we're going to dig in a little bit. So, Earl Campazzi is with us today. He's a top doctor in South Florida, and he specializes in primary care. And I'm going to read a little bit about his bio to give you some insight as to his experience. Dr. Earl Campazzi is a board-certified physician and is trained and practiced at some of the finest medical institutions in the country. At the Mayo Clinic, Dr. Campazzi spent several years on staff providing medical care and teaching the resident physicians. He also completed his medical training at Johns Hopkins University and served as chief resident there. Dr. Campazzi holds additional postgraduate degrees, including a Master of Public Health, a Master of Health Science with an emphasis on immunology and infectious disease, both from Johns Hopkins University and the Bloomberg School of Public Health. In 2020, he completed the Stanford Genetics and Genomics Certificate Program at Stanford. Dr. Campazzi also earned his Medical of Business Administration and Health Services Management from Duke University. And Dr. Campazzi has decided to focus entirely on primary care, concierge medicine in Palm Beach under the name of Campazzi Concierge Medicine. Dr. Campazzi is a Castle Connolly top doctor. He's on staff at Cleveland Clinic, Florida, as well as Good Samaritan Medical Center, St. Mary's Medical Center, and the Palm Beach Children's Hospital in West Palm Beach. In 2024, he published Living with Pancreatic Cancer, a Patient and Family Guide, and we have a link on our website to that book, should you be interested in taking a look at it. And if you have if you yourself or a partner or spouse is undergoing treatment, or you have friends with this disease, this could be a very helpful book for you to look at. So, with that being said, I'd like to welcome Dr. Campazzi to the podcast. Welcome.
Oh, it's a pleasure to be here, Joe.
Thank you. So getting ready for our primary care annual visits, one of the things that I've always been interested in and looked at is blood work. Every time you go to your primary care physician, he takes blood work. And a lot of us don't understand, what it means. What are some of the significant markers, and how do we interpret this, and how do we monitor and improve these markers if they're kind of above or below average?
Sure. There's a lot of aspects to that. I think one of the most basic is what insurance companies routinely pay for. And to their credit, they pay for what I think is the most important and I would just say it that way, the most important
Right.
of the lab tests. They certainly don't pay for some of the extended tests. And then beyond that, there is some testing that functional medicine, et cetera, that I at least don't routinely use. It may have some utility or may not. Some tests kind of get to be esoteric.
Right. What are the most crucial tests you think for the over 60 cohort?
Well, the two most crucial are what we call the comprehensive metabolic panel, which is actually 20 tests. And that's your sodium level, your potassium level, your measure of kidney function, measure of liver function.
Right.
Kind of just the bread and butter tests. Then also the complete blood count, taking a look at the number of red blood cells, white blood cells. The red carry the oxygen, the white fight infections.
Right.
We look in particular for not having enough cells, for having cells that are the wrong shape or that are grossly abnormal. That could be a cancer, rare to find, but is a very essential test because it can tell us about several different kinds of diseases.
Right. So there's a lot of talk and literature about cholesterol
Yeah.
tests. What are your baseline markers that you think are below average, above average, or And what
Yeah,
do you want to strive for?
cholesterol is a very tricky topic
Mm.
because it's been sort of ingrained in people that, eat a low cholesterol diet and spare yourself from heart disease.
Right.
Or truly, what causes most heart disease, when I say coronary artery disease, which is the buildup of fat in the walls of the artery and then pinching in so the blood can't flow. Um, is the level of sugar or carbohydrates,
Mm.
and that then your insulin kind of chases that. So if you eat too many carbohydrates, your um, pancreas has to release extra insulin, and that's inflammatory, and that kind of opens up the vessels for the cholesterol to come in.
Mm.
So in a perfect scenario, we wouldn't have to worry that much about cholesterol, but I still like to measure it. It's not as important to me as some of the other measures, but I do like to measure it, and I target below 100 on the LDL. The other important test is triglycerides, which is kind of we call it the diet lie detector
Mm.
test,
Mm.
because if your triglycerides are high, your diet's poor, and it kind of catches up to you within like the last week or so. So you kind of can't fool Mother Nature. You can't fool your doctor on this one. A couple of others that are not as well known is a lipoprotein A, which is genetic. You only have to check it once, and lipoprotein B, and that's another one that has a significant role.
Right. So lipoprotein A, little a, is
Yeah.
genetic, and there's not much you can do about that because you're born with it.
Yeah, there's some new work that it can lower it, but in general, you're correct, and it doesn't respond to diet or exercise.
Right. And the lipoprotein little a is that a syndrome where you have more fatty buildup in your arteries? It
Yeah,
just
you have a tendency towards it, and so it's even more important if you have that genetic variant with your lipoprotein A higher, that you have to be even more concerned about your lifestyle and the other factors.
right. And you mentioned lipoprotein B. Is that kind of a mitigator of lipoprotein A? Keeping that?
No, no, it's a separate risk factor,
Okay, it's a risk
but
factor.
that's one that responds more to diet and especially weight,
Okay.
and yeah,
So in addition to your HDL, which is the
yeah,
good cholesterol, that should
right,
be high, right? And
yeah,
the LDL, which should be lower than 100. You
yeah.
have these other two factors that doctors should check, but most doctors don't check. I don't.
Yeah, we get the broader. You can supersize your
Mm.
cholesterol panel, and we get the broadest cholesterol panel for our patients. Now, sometimes we'll get the smaller one if we know the other risk factors, and we're just wanting to take a look at how they're responding to treatments. But for an annual physical, we tend to get the broader one, and then there's some real technicalities that some of the HDL can be bad, and some of the LDL is not as bad as others. So you
Uh,
can break it, you can what they call fractionate it. So you can get way down in the details. But I would say, to kind of take a step back, if you're controlling your weight, if you don't have like a big belly, over 40 for a man, over 35 for a woman, and if you avoid sugar spikes, especially late in the day,
mm,
so the worst is probably dessert with dinner,
mm,
and having some carbohydrates earlier in the day when you can burn them off
right,
is much easier on the body.
right. And things like bread can raise your glucose level and get you into that range.
Yeah, and Details, 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 but
Yeah.
sourdough bread is probably among the best
Ah,
because it doesn't raises the blood sugar slowly, which is much better physiologically. And so, if you happen to like the taste of sourdough bread, that should be your choice.
that's really good information. One of the things that I keeps coming up is blood pressure, and you know the guidelines seem to be moving around. I remember a couple of years ago it said for people over 60, maybe 140 over 90 would
Yeah.
be okay, because I guess as you get older, your arteries harden and you get some stenosis, and it's harder to get the blood flowing. What do you recommend for blood pressure for someone over 60?
Um, we really shoot for 130 over 85.
Mm,
And even better if you can keep it at 120 over 80. Now, the thing with blood pressure, and we see this in our hospitalized patients, is blood pressure will change if you roll over in bed. So it's not a stable number. So what we're looking at is not a single reading, but the average. The other thing about blood pressure is it's going to go up sometimes, and especially if you go to the emergency room. I've had
sure.
patients be scared to death because their blood pressure is 160 over 90 in the emergency room, and we don't want it there long term. For the vast majority of people, that is not a near-death experience. That's just a reaction to
Sure.
adrenaline in your body, and for whatever other reason you're going to the emergency room.
Right. So is it worthwhile keeping a diary of your blood pressure at home? Because I have
Oh,
white coat syndrome. I know when I go to the doctor, my
yeah,
blood pressure goes up every time and I can't control it.
yeah,
So I always kind of bring, oh, by the way, I took it this morning at home and it was this, and here's
yeah,
my readings from the
yeah.
last 3 weeks or whatever, before getting ready for my visit, that is.
It's funny. My father had white coat syndrome, and I used to tease him. And they're like,
Yeah.
"Do I make you that nervous?"
Yeah. Yeah.
But yes, very much. Since it's the science of the average, to have multiple readings at home is far better because that's where you live. You're only in a doctor's office for an hour every 6 months or whatever. So we like the readings from home, but there are a couple caveats. We don't like the wrist blood pressure monitors. We just don't find them to be very accurate.
Uh,
And just as a ballpark, you spend about $100 to get a kind of a good quality blood pressure monitor
uh,
at home.
okay. So the other point on blood pressure is, I guess the right way to take your blood pressure is not when you walk in the door, you walked up a flight of stairs, you
Yeah.
get there for 2 minutes, you sit down, and they want to take your blood pressure, right? You need
Yeah.
some time for it to,
Yeah.
yeah, to
Yeah.
settle.
We like, uh, yeah, sometimes we make the mistake just to get it done
Yeah,
that we do take that blood pressure early. But if we get a high reading early, we'll take it much later in the visit, like
right.
right before we're going to wrap it up. And if you know, my preference is to take it later in the visit anyway.
Right.
Yeah.
So, there's a lot of kind of unreliable information about health and wellness out there. Some of it's bogus, some of it's misleading. And in that context, we get a lot of solicitations as laymen for tests beyond the standard blood tests you're talking about, like cancer blood tests like Gallieri or
You know.
the Prenovo full body MRI. What do you think of these, or genetic testing? What do you think of these extra
Um,
tests?
it's interesting. It's evolved over time. I was one of the early adopters because to the extent possible, I do these things on myself first to see the
Okay.
experience, to see the results. And I had my whole genome sequenced almost a decade ago,
Hmm.
and received a nice 100-page report that I couldn't make heads or tails of. And since then, I did take this Stanford course. But what's really made the difference is AI. We now work with a company, New Amsterdam, that does an AI analysis of your genetic results, makes it much more understandable, puts it in graphic form, groups it by diseases, and uh, genes are a little bit like playing poker. It's the probability. I mean, what's the chance you're going to win the hand with two pairs? Pretty good, but somebody could have a higher hand, I guess, a
Right.
straight or a flush or whatever. I'm not a poker player, but genetics is the science of probabilities. But it's also lets us know about uh, metabolism of drugs. And you've probably, maybe in your own experience, and certainly you've heard from others that this drug doesn't work for me, or this drug I need very high dose, or this drug, even if you give me a tiny amount, that's all I need. And that's actually true because it has to do with the breakdown of the drug. Like if you have a couple of beers, the alcohol is gone by the next day.
Right.
And that's done through the enzymes in the body, primarily in the liver. The same is true with medicine. This is why you have to take it daily because it breaks it down. But of course, people aren't cloned, and some people will break down a specific medicine much faster than other people, and we can tell that from genetics.
Mm.
And that, so you don't necessarily have to get the whole genome sequencing, which is about $1,000 now, but I really recommend the what's called MTHFR pathway, or
Yeah.
drug metabolism testing, which is like a couple $100,
Right.
and is very useful. You mentioned a couple other things, Pernuvo.
Nuvo, yeah, the
Yeah.
full body MRI. Yeah.
The knock on that is that you're going to see something, and then you're gonna have to pursue it, um, and it's going to worry the patient, and you're going to spend a lot of time pursuing things that aren't going to lead to anything useful. Well, I disagree with that, and we have had quite a bit of experience with our patients getting Pernuvo
Mhm.
testing. We've had one patient that out and out his life was saved by it.
Mm.
That they found a mass at the base of his tongue that didn't yet cause symptoms, but it was big enough that if they hadn't started treatment right away,
Mm.
they wouldn't be able to cure it. But this was one of those curable cancers, and he went through quite a bit with chemotherapy and radiation, but came out cured and without any disability. And we've had some other like a benign growth. Not every growth is cancerous, but we had a benign growth that was starting to pinch on a nerve, was having some nerve pain that wasn't yet diagnosed, and this diagnosed it right away because we could see kind of upstream growth pinching on the base of the nerve.
Right.
Had to have that removed, but it
Interesting.
was a non-cancer, and we've had quite a few, maybe less significant, but other findings. And we also use our judgment. I mean, that we don't have to pursue everything. That statement just is wrong. We can use our judgment and pursue things that we think, and by pursue, I mean further testing, things that look like they're problematic. If in our best judgment it's a nothing, we don't have to do anything further.
Right.
The Galleria test, and now there's a new test.
That's the blood cancer test?
Yeah, blood cancer
Yeah.
test. It's great science. Our experience is we have yet to have a kind of a hit, as they call it, a positive test result that found something that was, dramatic or otherwise. We've yet to have a positive on that. There's a similar but less expensive test that just came out by Exact Sciences, which is the people that make the Cologuard test, where you send the poop to the
Right.
and they can tell with like 95 to 99% accuracy whether you have colon cancer. I think at 95% accuracy. But anyway, so Exact Sciences have a competing test with the uh, Galleria test, which is by the Grail Corporation. So we're kind of sitting back a little bit. A few patients want those. There's no reason not to get them, but we have not had quite the experience that we have had with the whole body MRI. And again, the whole body MRI doesn't, use any radiation, so it's not going to cause any harm.
Mm. So you mentioned the Cologuard test.
Yeah.
That would not be in lieu of your colonoscopy, would it, or could it be?
It in some cases, there are some people for a variety of reasons, say they lung disease or significant heart disease, that they're just not candidates for a
I
colonoscopy.
see.
Then it could in those cases it could be a replacement. We have quite a few people that just even though colonoscopies are nowhere near as bad as people imagine, it's the prep is a nuisance. You
Right.
just got to be by yourself and kind of take care of business. The next day is easy.
Yeah.
You go there, they start an IV, they put you to sleep for 15 minutes. They don't cut anything that you don't wake up, like you do from an operation, and by the following day you're back to normal.
Right.
But nonetheless, a lot of people, and I mean, probably 10, 20, 25% of people just refuse to get colonoscopies. They don't like the thought of it. And, I can see, and it's hard to talk them into it, but the compromise of getting the Cologuard test is certainly a good compromise, because the test has just gone from 90% accuracy to 95% accuracy. So they're improving the tests all along. And kind of a funny thing, I once in a while my patients will invite me to a social gathering, a cocktail party, and I'm staying there with a couple of patients, and they said, well, the question is, do you have to tip the UPS driver because they have to know what's in the box?
That's good. That's good. Well, I can say that two members of my family, I have five siblings.
Yeah.
Two members haven't gotten colonoscopy yet, and they're both over 60. And I keep telling them,
Yeah.
you gotta do this. But now I'll recommend, if they don't want to do it, at least do the Cologuard test.
Well, President Reagan, his life, of course, was dramatically saved by a trauma surgeon when he was shot, and had a bullet that lacerated his lung. But it was also saved by his routine physical, where he had a colonoscopy. They caught a colon cancer early, removed it, and it was kind of lost in history, but indeed that saved his life as well.
Wow. Yeah, that's the advantage of the colonoscopies. At least they can remove the polyp when they're in there.
Yeah. The Cologuard test, if it's positive, then you do have to have the follow-up colonoscopy to take the polyp out.
Exactly.
Yeah.
Exactly. So I want to get to a really important topic here, and that's metabolic syndrome.
Okay.
I guess 50% of people over 60 have metabolic syndrome.
Yeah.
So what is metabolic syndrome?
Metabolic syndrome is how can I say it's a bunch of conditions, and it's easier just kind of list them, but they're basically being overweight for men, waist greater than 40, for women, waist greater than 35, fasting blood sugar greater than 100, a blood pressure greater than I believe it's 135 over 85, if I have that correct,
Right.
or 130 over 85. But even slightly increased, an LDL or greater, or HDL less than 40, and triglycerides greater than 150. So basically, you're too heavy and your lab tests aren't great.
Right.
And that puts you at risk for quite a few things. Increased cancer risk, increased cardiovascular risk, increased diabetes risk. And it goes back to what I was talking about earlier, that to have your blood sugar kind of like the roller coaster ride in the amusement park, where it goes up and then it crashes down, and you can feel that. Everyone kind of knows the sugar rush and then the crash afterwards. If you're feeling that, that's just not good. That was too much sugar. And so that is becoming really kind of the heart, the foundation of a lot of diseases is this glucose regulation. And of course, the body does, just like bears before winter, where they eat a lot of carbohydrates. The liver changes carbohydrates into fat. The bears getting fat, that's the right thing for them, so they survive the winter. But just because we're not necessarily eating all of that much fat, our body is turning it into fat, and that's where we wind up in trouble.
Right. And I guess one of the things we look at in the blood test is it A1C? Is that the marker for?
Hemoglobin, yeah.
Yeah. Is that that's the marker for diabetes, right? Is that?
It's not the sole marker really to take a look at. You need several tests, hemoglobin A1C being one of them, but it's if you're a cook, you know about like caramelizing, or where you caramelize onions or whatever. The blood sugar sticks to the outside of the red blood cells, and red blood cells live almost exactly 90 days,
Mm,
and we can tell how much blood sugar is stuck to them onto the walls through this test, and that will give us the what your average blood sugar was for the last 90 days. So, we get one kind of snapshot where we take a fasting blood sugar that morning, and then we get more of a movie over the 90 days, and that's the hemoglobin A1C.
right. And I guess since we're no longer hunter-gatherers, we can't be loading up on like bears, loading up on carbohydrates because
Yeah.
that creates something called insulin resistance. Is that
Yes.
right? And what is that?
Um, insulin resistance, insulin is released into the bloodstream when your blood sugar goes up, because the sugar is up outside of your cells, and the sugar level inside the cell where the sugar is needed isn't up. So you've got to get it from the outside to the inside, and it doesn't go on its own. It's got to be more or less carried by insulin,
Mm.
and so insulin's the molecule that carries the blood sugar from the outside of the cell to the inside of the cell.
So it can get flushed out,
No, so it can get used.
get used. Oh, okay.
Yeah,
Okay.
yep. But what happens, like with so many things, that if you overuse it, it stops working as well.
Oh. And insulin's created by the pancreas, is that
Yes,
where
it
it comes
is.
from?
Yeah.
And then so eventually you become insulin resistant, so it doesn't work anymore. Is
Well,
that
it
right?
works less well.
Works less well,
Yeah.
and that can contribute to diabetes.
Yes, because your blood sugar is going to, part of the insulin taking the sugar into the cells lowers the blood sugar level in the serum, or in the bloodstream, and if it's not able to do it as effectively, the blood sugar becomes high, which is one of the definitions of diabetes.
Right, and what so, and the downside of having diabetes is you have lower life expectancy and
Yeah.
other conditions.
Yep.
Yeah.
And it's also related to dementia,
Mm.
and both not only heart disease but also cancer. So
Wow.
yeah.
So what are the kind of behaviors we can exercise to either prevent it if we don't have it, metabolic syndrome if we don't have it, or
Yeah.
mitigate it if we have it? What do you recommend behaviorally wise?
One of the biggest things, I think, is to be practical, because
Mm.
so many times people have tried to be perfect from like January 1 to maybe they make it to January 15.
Right.
And we can't be perfect. It just we have other things to do, but what we need is some general guidelines. And
Mm.
basically, what I like for my patients, and a lot of people either don't want to or can't tolerate being a vegetarian, and I don't. If that's a route for you, I think by and large that's pretty healthy, as long as you supplement the few things that you can't get through that type of diet. But talking about everyone else, uh, I want your breakfast and your lunch to be, you know, pretty healthy, so you're, not starving, and you could be more liberal with some bread, some carbohydrates, both breakfast and lunch. Not going, overboard. Like potato chips and French fries are probably examples of the worst foods, but
Right.
staying with some fruit. But if you have a sandwich with the bread, you have some toast, or even eggs are great for breakfast. But if you have bagels once in a while, whatever. But the meal I really focus on for my patients is the evening meal. And let's set aside, because we don't have to be perfect every day, your meals out, but your meals at home, your evening meal should be just a small portion of protein,
Right.
and a small portion of vegetables, and eat it before 6 o'clock, ideally, or but early in the evening as you can, and then fast. Only water from then until breakfast,
Mm.
and that will help you not accumulate fat overnight, and we find that to be really good with
Mm.
also preventing diabetes and insulin resistance.
Right. You and I spoke before this
Yeah.
podcast about behaviors, and we mentioned the three important behaviors for seniors would be diet, exercise, and sleep.
Yeah.
And I asked you, what in what order should we prioritize that? And your answer surprised me. So, what was your answer on that one?
Yeah, again, it's almost like building a house. The foundation, or the keystone that everything rests upon, is sleep.
Mm.
The sleep does tremendous things for your body. It kind of flushes out a lot of the proteins that could later form Alzheimer's. It's but it also makes possible the other two. It's very hard, not that you can't, but it's very hard to exercise if you're tired. And the tendency, if you're tired, especially if you've got any sort of busy day, is to get a little extra sugar for a little more energy,
Mm.
get some extra caffeine, which will impair even the next night's sleep, and just to eat a little bit extra, uh, all because you're tired and you're just trying to cope. But if you had a good night's sleep the night before, much easier. And I especially like morning exercise, because the day happens and
Right.
you get tired, and it's hard to get it done at night. Some people can.
Yeah.
I find it works best for me. And then it's much easier to be disciplined with the diet if you're not tired.
And you can't exercise your way out of a bad diet.
No, there's a saying that abs are made in the kitchen.
Yeah.
It's not through sit-ups, although it's great to keep your abs strong. But if you really want kind of those washboard abs, or
Yeah.
anything that approaches that, it's by watching a diet.
Interesting. So I want to get to another interesting subject for me is vitamins and supplements, because we're constantly bombarded with commercials and solicitations, and to take this supplement and that supplement, and you need these vitamins. And my feeling is, if your genetic profile maybe would tell you that you're deficient in a certain chemical or enzyme or molecule or whatever, you may want to take a vitamin. But I don't. If you have a healthy diet, do you really need to take vitamins and supplements? Or
I guess the answer to that and all questions is it depends. But
Yeah.
it's interesting that there are at least 30,000, and depends on how you exactly measure it, up to 100,000 different kinds of nutritional supplements.
Wow.
And of those, there are about 20 that we can actually measure in the body.
Hmm.
Now, there's a couple that we really focus on. The first being vitamin D, which is actually not a vitamin. It's a hormone.
Hmm.
Hormones are the most important chemicals in the body. Vitamin D is just extremely important to supplement if your level is low. It's extremely important to measure it. So part of your routine blood test. Your doctor should be measuring your vitamin D levels at least once a year, and supplementing, heavy supplement if it's low.
Because a lot of us don't get out in the sunshine enough or eat foods that are high in vitamin D, I
Yeah,
suppose.
I mean, and it's also to have your vitamin D high enough from sunshine alone kind of puts you at risk of skin cancer.
Exactly.
Yeah, so
Yeah.
and I'm a big one, to get a little bit of morning sunlight before the sun is shrunk is great for you,
Right.
but not basking in the sun to turn dark.
Right. What about magnesium?
Magnesium is another vitamin that we can measure. If it's low, we definitely supplement. It's a cofactor in a lot of enzymes. Enzymes are like the little machines of the body
Mm.
that does the chemical work. So it depends on if it's low or not, and then you get into a lot of complications of there's several different types of magnesium and which your body might absorb better.
I just mentioned this because a lot of people seem to be using it for sleep as a sleep aid.
Yeah, it can help with sleep.
Okay, right. And there's a lot of these, a lot of supplements are fish oil or omega-3 derived.
Yeah.
I guess if you eat enough fish, you probably don't have to take them. But if you don't, are they
Yeah,
important?
here's one that we've had people overdo it with fish, and actually get their mercury going up. So
Right,
more isn't always better,
right.
and um, we can measure fatty acid levels. I wouldn't say they're as important uh, in general, as vitamin D and B complex and magnesium, but at least it's one of those that we can measure and we can supplement it. Whereas some of these um, supplements, milk thistle. Well, I'm not an expert. I just always go to that because it's
Yeah.
such an interesting name. But we can't get a milk thistle level, so I don't know if you need some or you don't.
Yeah. Yeah. Yeah, that's getting right. That kind of makes the counter argument is some of these supplements you probably really don't need, but they're important ones like the B complexes, the Ds,
Yeah.
maybe vitamin C, if you don't
Vi-
eat enough fruits,
Vitamins.
vegetables.
Yeah, I mean, the dramatic example is the sailors who had scurvy way back when there were sailing ships, and yeah, and this vitamin C miraculously cured this disease.
Mm.
But that so but that doesn't mean that it's miraculous for people that have ordinary diets that need extra. It can, vitamin C in with an upper respiratory infection can kind of it won't cure it, but it can shorten the course by a day. And
Interesting.
so
Yeah.
and
Okay.
it does almost no one harm to take some vitamin C when you're sick. So that's okay. But I wanted also just to make a point from a bigger perspective. I mean, say you struggled your life, worked hard, saved, and your kids are now through college, and you can finally, you're set, and you finally buy yourself a Ferrari. And then your brother-in-law comes along with a gift of a gas supplement to put in the tank of your Ferrari.
Yeah.
And you're like, no way, no how are you putting anything in my Ferrari tank?
Exactly.
But yet people on the recommendation of somebody in line at the grocery store will try this supplement, we'll try that supplement, and we'll also have like no way to determine whether it's helping them or hurting them, because a study of one of yourself provides no good data.
And some of these supplements may have interactions with each other if you're taking from different sources and you don't know what it's doing to your body.
This is one of the simplest things you can do with AI, and is just to simply type into a chat GPT or Grok or any of the common AI platforms. Type in your list of medications, the dose, along with your list of supplements, and then just simply ask, do any of these interact? And more times than not, you'll at least get some feedback. Don't take these two together, at least space them out in time or whatever. But that's a very simple thing you can do with our new toy AI you don't have to be any sort of expert to just type in your list.
And some of these may interfere with your efficacy of your prescriptions
Yes.
as
Yep,
well. So
yep,
that's
yep.
another important, topic for ChatGPT. You
Yeah.
want to talk about
I I like an antidepressant and St. John's wort, kind of double up on each other and can lead to serotonin storm. Or so, but the St. John's wort is a mild antidepressant, but if you add a prescription strength antidepressant on top of it, it's just not a good thing to do.
Okay, good.
Yeah.
So, being on the subject of AI,
Yeah.
you told me you're working on a podcast for AI in medicine, or
Yeah,
tell us about that.
I have a book that's coming out in January. It's called Better Health with AI, and it's uh, being published by Post Hill Press. And so, they gave you just a little sneak peek as
Good.
one of the recommendations there is to type in the list of your meds and the list of supplements. But there's a lot more that AI can do for you right now. And you don't have to be a programmer. It's a very simple thing where you ask it a question and it gives you the answer. The technical thing that calls it the question is a prompt because doesn't necessarily have to have a question mark after it, and the answer is called the output. You can get a list of recommendations if somebody has a new diagnosis. You can say, tell me who are the best specialists in the area. Should I get a second opinion? What's this best medical centers in the country for this specific thing. You should be careful, and we can't go into the whole thing, but
No.
and double check, especially the important aspects, and certainly check all of this with your doctor. But it can certainly give you quite a bit of information and make you ask some smart questions.
Right. So so I got to make sure I put your book on our Seniors Need to Know website so people know,
Okay.
when it's coming out and when to get it.
Yep, it's not ready for pre-order on Amazon yet, but I think the pre-order thing will be set up within a month or 6 weeks, and then it will actually be delivered in the beginning of January, or hopefully a little sooner. We'll see.
Great. Well, listen, we'll be right back. When we come back, we're going to talk about two of my favorite subjects, alcohol and gummies. So
Okay.
when we come back.